welcome everybody. Happy Thursday. I know it's most people's Fridays in the dental world. I'd love to introduce myself to you. My name is Rachel Carfeld. I am the Director of Customer Success at the Dawson Academy. I'm also launching our practice management complete care consulting program that I know Pete Dawson, but when he was alive, he had some thoughts and vision to how to implement a program like this into the Dawson Academy. And we're super excited, as I'm super excited, but when I was brought on here to actually help build that and launch it to our Dawson community and beyond. So today I get to launch out a webinar. It is my first one, so go easy on me all, just kidding. To have a discussion around, leading with vision. And, one of the things that I know as somebody who's been a practice management consultant for the last 18 years is, first thing of making any decisions to guide your practice the right way is having the right vision. It's being a good leader. It's about having goals. And we're going to cover all those things today because running a practice is not for the faint of heart. It takes a lot of determination, endurance, and vision, as well as patience, CE, not T, to run a really great practice. And for those of you, when you were 10 years old, dreamed that you were going to become a dentist and run your own business and deal with people who are your staff all day, are sitting here, excited about this. I'm super happy about that. But, if it wasn't your first choice to, run an office and run a team in any way, but just become a really good clinician, welcome to the club. You made a great decision, and the Dawson Academy is here to best guide you, and not only clinically, but also with continuing Dr. Dawson's legacy with implementing a practice management program to assist you and your team and your patients to a whole new level. This is a well-rounded experience for any client to be a part of. And, this is going to be a very high level, discussion about being the type of leader that you want to be and getting your vision across so that you're achieving goals that you have. To give you a little bit about me, I've been in dentistry for the last 18 years as a practice management consultant. I work with practices, taking them from good to great. So you don't have to be a complete mess in order to work with me. Some are, some aren't. Some are really great at what they do, and they just need some change. And how I work with practices is really customizing the experience, customizing your implementation to best support immediate and long-term goals so that you can be successful in achieving sustainable growth. So this presentation overall will focus, like I said, on a high level of being a leader, getting your vision across to achieve specific benchmarks for you and your team, not just to create growth within your practice, but also build the confidence and empower your teams on a day-to-day level, and making sure you're creating the right culture, to implement not just your practice management philosophy, but also with your clinical. Because I know a lot of you have taken clinical courses, you've spent a lot of money, invested your time and the time of your practice into learning how to build your craft. The hard part is going back to your office and getting your team to actually do it with you. And that's where we're going to kind of dive in a little bit deeper into this today. This is about launching a point of understanding of how to best set expectations for you and your team. Getting comfortable with being uncomfortable. It's a quote I use constantly as a advisor to a practice and to doctors. It's understanding that we're good with change, that change is okay, that we will be uncomfortable with it at first, but we're going to be comfortable with being uncomfortable with it. And then, of course, setting benchmarks to go from good to great, utilizing SMART goals in your practice. So just to get a little housekeeping in place, if you have questions for me, there's a Q&A button. You can actually type in your questions, and as we go through this, I'm going to go ahead and answer them. And then if you want to chat in the Zoom, we have Dylan, who's in the background here. He's manning the Zoom chat. And if you have any questions for him specifically or me, we will take a look at those as well. All right. So let's start with leadership behaviors. So if we look at management, and Steve Jobs said, management is about persuading people to do things that they don't want to do, while leadership is about inspiring people to do the things they never thought they could. Okay, so when we look at leadership behaviors, we're looking at how to inspire people. And there's different types of leadership behaviors out there, and we'll go into a little bit of detail on it as we move along. But, how do we get people to achieve the right attitudes in the day-to-day of the practice, hitting on what you expect? How do you become, I like to call it a level 4 leader, where you lead through others? Okay. And when I've worked with practices in the past, a lot of the doctors that I've worked with had, I would call it challenges, with their team, feeling that they have to micromanage every single thing that they do. And once you get some of these qualities built into your practices and as well as your leadership capabilities, it becomes less and less hands-on, where you can then trust your team to be a little bit more hands-off. And I will just preface it with this: there's no magic pill that I can give to anybody to do this. It takes time, effort, and training to get everybody to that level, including you as leaders. So what do? We look at how do we inspire a team? And there are many aspects of being a leader, and there's probably about 10 common leadership traits that all of you have in some way or another. Now, I'm not going to give you all 10, but I will give you some of the more common ones that I've dealt with in the past. Are you a transactional leader? Transactional leader is really dealing with performance and goals. That's their main focus, is how is everybody doing? Are we hitting our goals day in and day out? It's all about numbers. Not a lot of doctors are transactional leaders, but there are some of you out there. Being a coach. Now, I'm a coach. I coach practices. I coach doctors. I coach employees. It's about being motivational, but it's also kind of, being able to say things that people may not want to hear, and coaching them to that next level from in and day out. Are you an autocratic leader? Are you an authoritarian, sorry, and results focused? Is it about do, hit this checklist, get it done? I don't care how it's getting done. We just need the result at the end of the day. Are you a democratic leader? Do you support and innovate? Are you a servant leader, humble and protective? And there are definitely pros and cons of each of these leadership qualities. Sometimes being a servant leader actually can work against you when you're overly supportive and kind of let things go. And I've seen that in some qualities of leaders. I've worked with great leaders who happen to be servant leaders. And yes, they're very supportive of their team. But when it comes to holding people accountable, it actually goes against them. And democrats sometimes are too democratic, where then decisions aren't being made. And it's more of an paralysis by analysis situation in the practice as you're trying to achieve anything, needing to get implemented. So it's about inspiration. It's about inspiring people to do the things that you want them to do and motivating them to get there. Now, I wouldn't be able to motivate my own team if I wasn't one to just jump in and get it done myself. It's, all about, are we willing to do the things that our team does actually motivate them to do well? And we'll go more into that as we move forward. So think about your worst day. Okay, so now I'm going to have you think, and I actually might have you add something to the chat here. Okay, how has your worst day affected you? Throw a couple words in the chat, even one word, and answers are fine. Exhausting, clinical work stress, change profession idea. Heard that a few times. Okay, anything else? Defeated, mental exhaustion. I love it. Stressed. Keep going. Any others? Anxious. Nothing worse than being anxious on a day-to-day basis. Angry. Yes. Questioning life choices. Annoyed. I've probably dealt with several dentists who said to me, I want to quit being a dentist and quit owning a practice and just go and work at McDonald's. And that's the last thing I would want you to do, because you didn't spend all that time and effort in dental school to actually just quit. Now, I want to turn this around. What do your best days look like? How do you feel on your best day? Angry, stressed, annoyed? It's not going to get you to where you want to be, but feeling happy, enthusiastic, keep going, energized, invigorated. You made a difference in patients' lives. I was waiting for somebody to say something about a patient. You could do anything. You could feel fulfilled. I was born to do this. I'm inspired, excited, empowered. Those are great, great answers. Sense of achievement. Absolutely. Positive energy. You guys are awesome. I'm super excited about this. Okay. And sometimes when some of these things go wrong in the day, then look at how does it affect the people around you? Okay. We think about the team. You are a leader. You are an influencer. There's a difference between being a leader and a manager, and I'll talk about that in a second. Okay, but when the schedule falls apart, when team members are late for morning huddle or just working, when we're not hitting the goals, when we have team members who are arguing amongst each other, we have hostile patients who aren't paying the bill, that's going to create a lot of negativity during the day. And guess what? They're all going to you for it. Okay, so, being a leader is about empowering with a positive attitude. Things could be worse, trust me. And, what I, do is guide you into that. What could be worse, and how do we resolve for what we have right now? Because once those things happen, it's going to be a trickle down effect between you, the rest of your team, your patients, and then eventually when you get home, the family, the kids, the dog, the cat, whomever you're face to face with. Okay. So, what, we want to make sure that you're doing is how do we rally around these things go wrong? How do we turn them around to go right? Even if it's not being right, if it's not right today. Okay. So part of this is about, understanding how do we turn things around? Okay. For those of you with office managers, or even if you're the office manager, managers administer and leaders innovate. The manager maintains and the leader develops. The managers focus on systems and structure, and the leader focuses on people. Now, I'm not saying a manager shouldn't be able to focus on people, but overall, they're a support system to be focusing on people. Manager's a title. It's a role of set and responsibilities. Now, if they manage the front desk and they're basically managing the phone, would I call them an office manager? Absolutely not. If your office manager handles payroll and your P&Ls and hiring and firing people, they're probably more of an office manager, looking at the HR side, being able to coach, being able to have open discussion with those team members. I've had some doctors who I basically sat them down and said, I want your office manager having those discussions. Why? Because they're qualified to do so. Okay. And it doesn't diminish you as a leader, but what it does, it helps you as a leader. And this is the best managers are leaders, but the two are not synonymous. Leadership is a result of action. And if you act in a way that inspires and encourages or engages others, you are a leader. Okay. It doesn't have to be a title or a position. So it's a quality, leadership is a quality that needs to be shaped. Okay. And when we talk about leadership, we look at through developing, that emotional intelligence and learning how to influence others. Professionals at any level can have a really great awareness of what's going on around them and understand how to bring out the best in themselves and others. And again, if you don't have an office manager, I've worked with plenty of doctors who don't want office managers, who don't have them. It's about kind of switching gears a little bit. Managers look at roles and responsibilities, but they also have to be there to inspire. And you can do both at the same time as well, if you want to. And if you don't, then you get an office manager who could do those things with you. So when we look at this, it's about empowering people. You want to empower a manager to help manage a team. It's about delegating. and ensuring that, we're delegating the right responsibilities to them. Don't just hand them over a laptop and the keys to the building and say, go. There's always going to be a very structured way of executing a manager role within the practice. Okay. Employees also feel that, they have a little bit more stake in the outcomes of the practice, knowing that you and a manager can help foster that leadership and foster their accountabilities. We're going to talk a little bit later about what those accountabilities are and how to really set them in a very structured way. But once our team members understand that they're empowered to be decision makers in the practice and help be participants in the practice growth, they become more empowered to actually get the job done that you're wanting them to do. Okay, so now let me give you the recipe for being a leader. Okay, so these qualities, help with being a leader. We listen effectively. We encourage teamwork and participation. Okay, now if your team members go and do a drive-by with you, and I see a drive-by as you're in the middle going from room to room, from patient to patient, and they come to you and say, hey, boss, can I have a vacation next week? That's a drive-by. Or Susie did this, and she should have done that. That's a drive-by. Okay. It's not the right time or place. Okay. And it doesn't give you the opportunity to effectively listen to your team members. Okay. So listening and making sure that, we're hearing what they say. If you're sitting in your offices with your patients and with your team members, they're having a discussion with you and you're on your phone texting, or you're on your computer doing Facebook or answering a patient question, you're not going to listen to them effectively, and you're not actively listening to them. And I could tell you from hundreds and hundreds of interviews with team members, when I ask the question, money off the table, we're not talking about bonuses, raises, anything. What is the one thing that you're asking from your leaders? It's listening and thanking them. Okay. It's being able to be heard. Okay. And you may not want to hear all the things that they say, and that's okay. But as a leader, sometimes we have to listen to the things that we don't want to hear either. So those are, some things to think about as leaders. Encouraging teamwork and participation. How many of you run team meetings and feel like you talk at your team versus with your team? Do some of them sit there and actually look at you like you have 5 heads? Do they just shake their head and then go about and do whatever they want? Any of you? You can type yes or no in the chat. But, now we're going into meetings with a purpose. What is the purpose? What should the outcome be? How do we get team members to participate? And I'll tell you one thing that I'm not afraid of: uncomfortable silence. Okay. When you ask that question, you stop, don't even say another word, and you start waiting for them to answer. I give you the same technique for a patient who's late to the office, or who's canceling an appointment. Okay. Or who's about to say yes to a treatment plan. Okay. So how do we make sure that, we're encouraging that and participation? Because you hire smart people, I would assume. So you want those smart people who actually live in the day-to-day of their jobs while you're in the back in the clinic working, to be able to actually participate in the day-to-day. Okay. And Dr. Prendergast asked, if you want participation, you have to ask for participation. You do. And I've run hundreds of team meetings with teams who just sit there and look at me like I am insane. Okay. But one of the things, I ask very open-ended questions and get them thinking a little bit more. Even if it's, I want you to go into Dentrix, I want you to pull up your list of patients who came in that had treatment plans in the last 6 months, and I want you to start looking at patients who have an upcoming hygiene visit with a treatment plan. Okay, now let's talk about, how are you going to speak about to this patient? Okay, so you do have to ask, and you might have to get a little specific with those questions to encourage that participation. Empowering your team members. I talked a little bit about empowerment. And no matter if a team member has been in their role for 2 months, 10 months, 10 years, 20 years, it doesn't matter. Everybody still has room for growth. Okay. And you can empower anybody at any time in their role to do something different. How about technology? How many of you have how many of you have team members who've been doing their job 25 plus years, and now you're going to implement new technology into their day to day? Okay. I'm sure they're not happy about it, but they might not be telling you up front, or they do tell you up front, either way. Okay. And thank you, Dr. Tom, being clear with those expectations. What are they and how do you hold them to it? Communicating effectively. Okay, so I like the technique, there's a couple techniques I like to use called crucial conversations. That's usually utilized when you're trying to come to an agreement on something that you may not have agreed upon with a team member. Maybe you're going through disciplinary process with them. Maybe you're going to write them up. Maybe, they're just outwardly not following through with an expectation that you have. You have a crucial conversation with those people. You come to an agreement, you give them a timeline. Okay, so as we communicate effectively, and we're going to talk a little bit later about the why. Why are you asking them to do it? Okay, I don't think I have ever gone to a team that I've led to say, you're going to do this and be done. It's, you're going to do this and here's why. Here's how it affects things. Okay. And you're giving them clear reason and you're communicating it, effectively. The other piece to communication that I know you all love for me to say is about documenting that communication. And I'm not saying complete a memorandum every single time you make a decision, but when you have process that you're putting in place in your practice, if it's not documented, it doesn't exist. And if I came to work for you next week in your practices, will I know how to answer the phone to a cancellation properly? Okay. And thank you. Good ad. Following up. Okay. So follow up with it. Make sure that they know. Some of my best practices I ever worked with are people who knew the process to other people's jobs. They didn't necessarily have to do it, but they definitely knew and understood how they would handle it if, let's say, the front office won the lottery tomorrow and they all took off to go on a world cruise for 6 months. Who's answering the phone now? Guess what? Your clinical team is. And if your clinical team does not know how to approach a cancellation, then we're all in trouble and we're back to square one. So I always follow the rule of document, document, document. Emphasizing long-term productivity. So what does that look like for a practice? It's not about numbers all the time. It's not about making money, but what is that productivity on a day-to-day level? Okay. Is productivity having the right type of schedule that we can follow that patients can fit into, where we're not overworking ourselves and getting out on time every day? Okay. Making sound and timely decisions. I mentioned earlier, paralysis by analysis. If you're sitting on making a decision for 2 weeks or 3 months, you're taking way too long to make certain decisions. And sometimes it's going to be a situation where we're going to have to try it out. And I've worked with practices where I've said to them, hey, I want you to start calling when people were calling up, appointments that were coming in this week. They were calling one day, less than 24 hours before the appointment. Guess what that did? It increased their cancellations. They didn't have time to fill in those spaces, and they would have their schedule completely fall apart. So the moment I would say, I want you to do it 48 hours instead of 24 hours, I would get the patients are never going to go with that. They're all going to forget. No one's going to come in, blah, 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 blah. Okay. And what ended up happening 6 months later, I got wow, you were right. We actually have a better running schedule because we're contacting our patients 48 hours versus 24 hours. And we're not running around trying to get the schedule filled at the last minute. Okay. So sometimes that change has to take place to, make that decision work. And we have to be a little uncomfortable and let it ride for a good 3 to 6 months before you decide to change it again. It's not a flavor of the week. It's, here's our decision. We're going to work on it for 90 days. We're going to come back and reevaluate it. And if we need to tweak it in some way, we will. Okay. So that's an area of opportunity for any practice. Treat each other as an individual. Again, this goes back to culture. What kind of culture do you want to cultivate within your practice? Okay. And making sure that we are following through as a team and being treated as we do, as we want to. When you have a team of 5 and you have one person who is the toxic one of the practice, it's 20% of your team. 20% can really break a team up in a very unhealthy way. So you want to make sure that, everybody is feeling that they're being, treated with respect. And it just doesn't come from the leader. It comes from the team within, who are internal customers. Knowing yourself and your team, protecting your team. Again, this is all about emotional intelligence and, being able to kind of spot check how people are doing. I always gave this kind of corny, suggestion to some doctors who had a very hard time saying thank you. And it wasn't intentional. It was just, they're busy. You guys are busy. And I used to tell them, I want you to put 5 pennies in your pocket on one side, and you should be transferring all 5 pennies during the course of the day to the other. It means that every single time 1 penny leaves the left side to the right side, you gave a compliment to somebody. Again, corny and cheesy, but it actually works and it's effective. And it protects your team, to feel that they're being cared for, and making sure that, they know that you're there for them. And then lastly, having a vision, courage, and commitment. So we'll talk a little bit about the vision as we go. Okay, so vision. Vision is the destination. It's the goalpost. It's the end zone for those of us who are football fans. And goals are the mileposts or yard lines along the way. Okay, so if we know what our vision is, and your team knows and understands what your vision is, it's to unify the team and drive success. Okay. And it's driven by, your decisions that you're actually making in the practice are driven by your vision. Now, I actually worked with a client about 16 years ago, and I ran into them at a dental convention about 8 years ago. And they remembered me, amazingly enough. It was dad and 2 sons. And they actually said to me, we still ask the same question when people ask us about what we need to do in the practice. Is it good for the vision? So when we're making decisions like purchases, whether it's purchasing another practice, purchasing a piece of equipment, hiring a team member, buying new technology, giving raises and bonuses, changing the practice dynamics in some way by adding another team member or an associate. You have to look at, does this jive with the vision that we have? Does it sit well? Is it going to move us forward in the right way? Because any decision you make is going to enhance the overall performance of the day-to-day. And when we align those team objectives, this is your opportunity to best support your team as a leader and level up your team over time. Now, any of you have ever brought in an associate, it's finding the right person who fits the mold. It's about, what the timeliness of that person coming in and how they actually interact with your team. And I've seen the ups and downs of it over time, over the years, of bringing in an associate to, and, help the practice move in a new direction, but it might not sit well with everybody, including your patients, not just your team. So, aligning these objectives that you have in your day-to-day will help ensure everybody is working toward the same goal. And that's what the vision is. It's what is the ultimate goal that we need to achieve in the next 12 months to get us to where we want to be. Okay. And when we sit down as a team, we're collaborating together to actually get us there to be productive and successful. Okay, so when we talk about creating that unified vision, again, it's the North Star for the team. It's how do we want to get there? And, there are a lot of doctors out there who create their own vision, and that's great. I have nothing wrong. There's nothing wrong with that. But what are we missing? We're missing the team involvement. And again, when we get team involvement in this, they're going to be more empowered to actually follow through with the vision. They're going to be motivated to get your practice to the next level, and they want to be a part of it. Okay, so there's definitely tricks and tips on how to get your team to be part of that vision creation over time. Because your vision could be a piece of paper, sitting in a folder. It could be a plaque on the wall. But how do we really live toward that vision? Is it driving us to clarity to success? Is it giving us organizational measurement to where we want to be? And the vision's an internal thing. It's not something that you typically would just bring out to a bunch of patients. It all depends on what you have in your vision. Some visions I know have financial goals in there. Some visions say I want to work 2 weeks less and take off 2 weeks at Christmas as a team if we increase by 20% in the next 12 months. Okay, so it's about dreaming big to how you want that vision to be displayed, aligning it with your business goals and values, and then how do you communicate it, with the team? Okay, are you committing time and resources to achieve the vision? And when I say committing time and resources, I'm talking about meetings. The one thing that I know most people hate to do. And we don't want meetings just to have meetings. We want meetings to be meaningful, that there are objectives and actions that come out of meetings. Okay, question. How do mission and vision differ? Good question, because I'm about to get there. A vision is more internal about, the practice itself and you as a team on where you want to go. The mission is how you're going to affect patients, how you're going to affect the community on the outside. Sometimes they can become synonymous with one another, but there are definitely mission statements out there that is open to be shared with the community. And sometimes it's one of the same in some areas. And on the screen, you could see there's some vision and mission statements that I included in here to some actual, to some actual companies that are pretty well known. Okay, TED, any of you listen to TED Talks? They spread ideas. That's simple enough. Okay, if we look at Google, to organize world's information and make it universally accessible and useful. Okay, Walt Disney, I was just there yesterday. And to entertain and inform and inspire people around the globe throughout the power of unparalleled storytelling, reflecting the iconic brands, creative minds, and innovative technologies that make ours the world's premier entertainment company. That mission actually changed because it used to be the happiest place on earth. Okay, and so that's changed over time since I've done this before. But those are your mission statements. This is what you want people to know about you and people in your community to know about you. And this is the stuff that you put on practice material, any brochures, like paperwork, any of those things to make it known that this is what you're trying to achieve with your patients and the community at large. Good questions. And then you have core values. Okay, so core values. If you ever Google core values, there's a ton of them out there. Now, as a team, you look at and you pick out 4 or 5 core values that you want to follow as a team. And again, this could be something that's displayed to your team. Our core values are exceptional service, compassion, integrity, highest quality, lifelong learning. Okay, things like trust, accountability, humility, ownership, continuous improvement. Those are commitment to customers. Those are all core values. So do you and your team have the core values in place that you all follow? And again, when you sit down with a team member at any point to communicate with them, whether it's complimenting what they've done or that you have to coach them on what they're doing, you're bringing these things back to them. Okay, because these are words to live by. These are values to live by in the day-to-day of your practice. Okay, so now we talked about vision and mission and core values. Let's talk about goals. How many of you have goals? Again, Y for yes, N for no. And I'm talking about specific benchmarks that we know that we're achieving type of goals. I'll give you all a second. Yes? I should have done the poll. All right, good. Now, there will be no judgment if you do not have goals, so that's okay. Okay. But, goals, looking at specific benchmarks to drive growth in the practice. Now, I know a lot of doctors who have goals that it's your goals. It may not be clear to the team what those goals are. I know a lot of doctors who use analytic platforms, they pull reports and have spreadsheets. But yet again, what do we do with that once it's there? Okay. And I am someone who loves numbers. I love spreadsheets. I love analytics. I love it all. It's kind of crazy. But, it's more about creating direction. Okay. So when we have those goals, what direction are we actually pointing the practice to based on those numbers? Is it too high level? When you have these conversations with your team members, do they feel pressure on achieving these goals? Are they realistic? Now, and looking at, actual goals, are they arbitrary? And again, this is no shade to any dentists out there, but I've had dentists where I say, hey, it looks like your goal is about $5,000 a day. How'd you come up with that? That just sounded like a good number. That's what we've done historically. Okay. And that's okay. Right. And, now it's looking at how do we create goals that are stretch goals that you are going to stretch you and the team to actually achieve. And again, it's not about money and production. This is about getting patients healthy. So every patient coming into the chair should leave getting healthier in your practice, which organically grows your practice monetarily. Okay. So let me make that very clear. Okay. None of this is ever about money. And I've never consulted to a practice and it's been production, production, production. It's about how to make sure your goals are getting you to a place where you're caring for your patients every single time. Okay. So when we set and achieve those goals, we want to make them clear and we're still motivating the team, but we're challenging the team. Okay. And I can honestly tell you, I do this with my own team here, when I speak to them about having their goals. Okay. And I probably get some dirty looks every now and then, but it's okay because I know that they can achieve it, and especially if I'm looking back at history and looking at what they've done, what do I think they can do without going crazy on resetting a new goal? And SMART goals. Okay, if any of you know that acronym, it's a great one. SMART stands for specific, measurable, achievable, relevant or results focused. I kind of like results focused myself, and time bound. Okay, so if we want to set a goal to increase our productivity by 20% year over year, that's a stretch goal. Okay, and we want to work 2 weeks less this year. Okay, by making sure we're providing complete care dentistry to every patient, I would call that a pretty smart goal. That's going to drive a different type of engagement and accountability. Okay, nothing more demoralizing than an unachievable goal. Absolutely. Okay, I mean, as a team member, I will say in a former life, I had a goal where I was told, hey, your budget's now 50% higher than it was last year. I can tell you the team was not exactly happy over it. And right away, we were all sitting there thinking, there's no way. And if you create it to be unrealistic, you're not going to get buy-in at all. Okay, so it's just like saying, I want to lose 100 pounds. Okay, you could say you want to lose 100 pounds, but how are you going to do it? I need to lose 1 pound a week by diet and exercise. Okay, that's more realistic than 100 pounds. Okay, so as a practice advisor myself, I consider myself like the personal trainer. I'm going to teach you how to do the exercise, how to build the muscle, and you're going to do it. Okay, and we're going to do it until you master building that muscle. Okay, so whether it's building the right schedule, trying to create a new system to achieve a certain goal, that's why we have goals set in place. Okay, and then you have key performance indicators and metrics for that growth. Now, there are benchmarks in dentistry out there. I'll share some of those benchmarks with you. Okay, is your retention at least 90% or higher? Okay, and retention is your patients in the last 18 months have come in through continuing care are actually scheduled for a next appointment. And that number is affected by two places, your hygienist building value and your front office keeping them into the schedule and avoiding cancellations. Now, if you're in a city like I live in Phoenix, Arizona, it's a very transient community. 90% may be unachievable. So we might drop that goal a bit based on, again, historical evidence. Okay. Cancellation no-show rate, less than 5%. Okay. How do we make sure that less than 5% of our patients are canceling on us and no showing? How do we create a healthy accounts receivable? And I say healthy, I won't get into this because I'm going to run out of time. Healthy is 1 to 1.5 times your average monthly production, and it's also PPO dependent. So you want to make sure that you're maintaining a healthy AR by giving your patients an opportunity to pay for treatment and giving them plenty of options to do so. Okay, your case acceptance, that varies. It varies on a percentage basis versus a dollar per patient value. Okay, and those of you who do things like complete dentistry and doing big cases that are over $10,000 a case, your case acceptance rate might be 30%, and that's still good. But if you're just doing fillings and crowns, your case acceptance rate may be a little bit higher. It might be more like 75%, which is great. So it's very dependent on how you would look at it. Hygiene percentage, your perio versus prophy, again, dependent on your area. Some areas have very little perio, where some are more dominant. Okay, elective and aesthetic dentistry. Do your hygienists and dental assistants co-diagnose? Are they helping you get patients to say yes? New patients, what's considered healthy? Most practices between 20 to 25 per doctor a month. Some of you may not want 20 to 25 new patients a month. And again, it's okay because quality over quantity. Okay, so you want to make sure like you have these metrics in mind and that we're giving the training to the team on how to get there. Okay, and here's an example of what I've done with some practices. So if we look at financial goals, again, we look at this as a year-over-year productivity and sustainability measure. Okay, and just understanding like your financial goals, like what does it take to run the practice? How much of my P&L is in my overhead? And what do I need to understand that I have to do if I want to fix my front office for $40,000 and I want to put a bonus pool of $20,000 for my team, and oh wait, I want to give myself a raise because I've been a dentist for 10 years and I think I'm deserving of more money. Okay, those can be really possible. Okay, and once we start looking at that, and oh, by the way, I want to buy a CBCT this year. Once we understand and put those in place, then we reverse engineer the goals to correlate with things like the schedule. What's the patient flow, in and out? Have we done a fee analysis? How did we work on our treatment plans to actually get us to achieve those goals realistically? Someone liked my quality over quantity comment. Thank you. And how do we ensure that success? Having scorecards for your team members, having job descriptions. The job description is the correlation with the overall success of the practice. It shouldn't be a list of tasks like turn on the lights, turn on the suction, set the trays up. That's part of their job. Okay, but what it should do is have something that discusses what each team member is responsible for. And, through things like, I'll give you a great example. Every job description should have something on there about marketing your practice. And again, this is not like hand out a bunch of cards and, like, let's get lucky with a bunch of patients. It's more of a very strategic, are we asking patients for patient referrals from our really valued patients who like us and trust us? Are we asking for testimonials and asking for reviews? It shouldn't be left up to the person who runs our Facebook and Instagram page. Okay, it should be everybody's job to actually do that, and it should be in everyone's job description. Okay, so that's creating involvement and fostering an environment where we're supporting our team members to help get them there. And again, that's also going to be done by the meetings that you have in the day-to-day of the practice. Okay, I think I talked a little bit earlier about shaping the dynamic of the culture. Okay, how do we create cultural changes in the organization is driving greater engagement and performance amongst your team members, where we complement. This is where we make sure that our team members feel good about what they do. Okay, and team meetings will help align the office, giving training opportunities that will help with growth. And if it's done on a whim, it won't stick. If we're just going to say, oh, tomorrow we're going to do this, And then what does tomorrow do? Tomorrow comes and then we stop doing it. Okay. When you come back from a continuing ed course and you learn how to take your photographs in a certain way, you go back to your team and say, oh my God, I'm so excited. I just learned how to do this at Dawson. They're going to look at you. Yeah. When are you going to implement this? And, like understanding what those clear objectives and outcomes that your team has, they're going to walk away to create action with workable that's working to achieve the vision. Again, a team meeting should not just be, oh my God, we're having a team meeting. Let's talk old business, new business, and then move forward. It shouldn't be a forum to complain. Okay. It's really about here's the plan, here's the goal, here's the purpose, here's the outcome. Now let's create action from it. And what are the attainable actions that we're going to do? Whether your team meetings are weekly, bi-weekly, I don't suggest going any less than 2 a month. Okay. And there's a reason why. Because you want to create change, you also have to train your team to get there. Okay. We can't just say something. We have to make sure that we're training everybody and they know how to actually get it done. And everybody has a good understanding of it. Because again, if it's documented and somebody falls short of actually achieving it, you can go back to that documentation and say, hey, do you remember when we talked about this? Here's the actual document that shows how that has to be done. And it could be anything from setting up a tray for an implant case to using the right scripting for collecting payments or avoiding a cancellation. You have that opportunity to do that with your team. Okay, and then fostering that proactive mindset. So I did kind of talk about this before as we encourage team members to talk, to participate, be good with uncomfortable silence. Okay, I don't know if any of my team members are on here, but I created a little uncomfortable silence in a meeting last week. And as much as it killed me not to have to say something, all of a sudden I started getting participation after it. But at the end of the day, I can't be the only one with the answers, as you can't either. Okay. And contributing in a positive way. It's going to identify who's on the bus versus who isn't. Okay. And, whether I've seen it or you've seen team members in your practice who sit on the side, filing their nails, looking at their texts on the phone, who might be, just kind of sitting back and letting everybody else answer. Versus them being a participant. And again, they could have been with you for 5, 10, 15 years. It doesn't mean they're still fitting the mold. Okay. So it's, I know finding team members is tough right now, but it's also finding the right team members who are going to follow through with what your expectations are is important. Okay. So when we talk about leading, we lead through change. And again, change is very uncomfortable for many people. I worked at a place where I used to interview consultants, and the first thing that came out of my mouth during the interview is, if you're not comfortable with change, this is not the job for you. And I've had people actually not take the job because of that. So, as we lead through change, we want to emphasize things like relationship building alignment as a team. Do we all agree? Okay, that's a great question to ask at the end of, talking about a system or new structure in the practice. Creating a compelling case for change. Again, what's the why? Why are we asking the team to participate this way? Establishing a clear vision and course of action. So you go back to your vision. Here's why we're doing this. Okay, and this is why I'm asking you to be a part of this. Prioritizing transparent and consistent communication. Now, I know sometimes it's uncomfortable. We don't want the team to know all the numbers in the practice, but at the end of the day, they do know. I'm telling you right now, they know. They know, how much a crown costs, they know how much an implant costs, but what they don't know and understand, I know I'm joking about this right now. I know they don't know and understand overhead, and they don't understand where does the money go, like once a patient pays for it. Okay, but you can be transparent with your team to help them understand, we have these goals for a reason. It's to pay to keep the lights on. It's to pay your salaries. It's to pay for the new equipment that we're bringing in so that our patients get the best possible care. Just like when you do a fee increase in your practice, you're telling your patients those things as well. And we're not ashamed to do it because you don't want to diminish the value that you provide to every single patient in the practice as well. Commit to consistent listening and responding to employee needs. So again, maybe doing a one-on-one once a month. And now, if you have a team of 20, it's a little tough. This is where an office manager comes in well, or just sitting down with team members or departments, once a month or once a quarter. There's plenty of different ways to actually handle this. And it just gets communication flowing throughout the group. Recognizing and celebrating success, large and small. You know what? Sometimes it's always really easy to focus on the negative. I could be that way myself. I am completely transparent, but, we also want to look at, what are some of the things that we did do that went well? And sometimes it's baby steps and it's okay. Hey, maybe we had a really good experience with a patient that came in yesterday, and they were so happy before they left, and it was a prophy patient. I almost said cleaning. It was a hygiene patient. So, like, how did that hygienist handle that patient and have them walk out ecstatic? Because probably that patient's going to go refer a bunch of patients to them. I'm a healthy prophy patient. I've referred dozens of patients to my dentist. Why? Because I trust them. I like them. They're amazing. They're a fee-for-service office. People are willing to pay them out of their pocket to go do the dentistry that they need to get done. Okay. And I just get pro fees. So, but I get the experience every time I walk through there. And then being patient and understanding. Okay. So how are we patient and understanding? And I know sometimes when you get riled up because of something going on, first thing we want to do is blow the top. But, it's about stepping back, giving yourself about 12 hours, in between the day to the next day, and then having a very well thought out conversation with a team member. And I will tell you from experience with one of our doctors that is part of our program, he went and did that with a team member, and the team member didn't know what to do after he had that conversation because she expected a whole different side of him. But when he sat back and reflected a little bit, and I gave him some food for thought on how to approach this team member, it was like a shock to her system. And now they're moving in a different direction. Okay, so there's definite possibilities of that patience and understanding. And again, this is going to encourage a lot of results-driven behavior that you have in your practice by setting those clear expectations, and you celebrate those achievements to get you to measuring success. And as I mentioned, there are benchmarks to measure success that's going to impact and guide strategies that you go through. Strategy could be anything from, running a highly effective and efficient schedule to how we get patients, on a follow-up call for a treatment plan that was discussed 5 days ago. Okay, so what does that impact look like once we do that? Okay, when I had a team call up a patient who had $4,500 worth of treatment and still had a mouth guard sitting on her treatment plan because she grinds her teeth, I started asking questions like, she keeps grinding her teeth. What's going to happen? Oh, she's going to grind down the new work. She's going to be in pain and have to come back in. Great. So is $600 a lot of money for somebody who just had $4,500 worth of treatment to actually get that, to prevent that in the future? And they all looked at me like I was crazy. And they said, no. Great. Call that patient up and have a different discussion with them. Guess what? Patient actually scheduled the next day. Okay. And again, there's no miracle to this. It's about really looking at, how we actually strategize around this and how we execute that strategy to achieve these goals of success. Okay. And your leadership is, assessing the performance of the team, looking at performance metrics, understanding things like employee satisfaction surveys. I like doing something called a gap analysis with my teams, and I look at same questions for both sides, the leaders and the team members. And what I'm looking for is there a gap on a scale of 1 to 10, between what the leader thinks about their leadership to what the team thinks about their leadership? And if it's a big gap, guess what? Something's not happening. And, now it's time to understand and create that culture of accountability that, helps with the overall productivity and engagement between you and the team. Okay. So role achievement. Do we have role scorecards? Okay. Role scorecards is basically having a team member rate themselves on a scale of 1 to 5. 5 is I'm perfect. I have no room for growth. No one's ever a 5. I've never been a 5. My team's never been a 5. Okay. A 3 is we meet expectations. We're doing our job. Okay. So do we have a role scorecard that is specific to the job role? Do we have job descriptions that has the vision of their job and expectations of key performance metrics that are part of their role? It shouldn't be a checklist of turning on lights and suction. Okay. It really is about what are they responsible for in their role? Do we have growth conferences on a quarterly, bi-yearly, or yearly basis with a compensation review with that team member? Okay, so how are we best, like the outcome of a growth conference should be, how can I as a leader best support you as a team member? How can I help you with your growth? And again, don't care if they've been there for 5 months or 20 years. There's still room for growth every single time. Book suggestion, I have plenty of them. I have a library list of about 80 books that I've personally read over time and recommend to a lot of our doctors. This is a good one that I usually start with. Start with why. Okay. And there's a great TED Talk that you and your team can watch together. Simon Sinek is a genius in my book. And it's a great, read to really understand why we, why we need to explain why. Okay, it's like a child. I have a 13-year-old. I have to explain why she needs to do certain things. Now she fights me on it because she's 13. But, she will, if as soon as I start explaining the why, she starts getting it in her head and understands. Okay, and I know we're almost at time and I'm actually almost done, but this should result in continuous improvement strategies. And there's a strategy behind this photo. Everybody should be rowing in the same direction. Okay, how do we make sure that as we want to implement continuous improvement strategies in the day-to-day of our practices, improve culture, improve feedback, improve alignment as a team, how do we make sure we're getting the team all rowing in the right direction in the right place? Okay, so the strategies I talked about before, that's the tipping point, right? Now it's like, how do we actually, ensure that those strategies beyond the strategies are getting implemented to get your team moving in the right way? So, where this is going now, I mentioned earlier in the very beginning, Pete Dawson's vision was to create this complete care consulting program with the Dawson Academy's clinical philosophy. And we're doing something that no other consulting company is doing. I should know, I've been part of a few of them. Okay, we're actually marrying both the clinical and the practice management together. I get to work with our world-class faculty on the clinical side to help you as dentists who are taking our courses. And even if you aren't taking our courses, you could still be part of, this really great experience of driving your practice into a direction that's going to get you from good to great, or even great to greater. Okay, so if you'd like to talk to me beyond this, you click on the QR code. It'll actually lead you to my appointment schedule. Again, this doesn't obligate you to anything, but it gives you an opportunity to ask some questions if you didn't have an opportunity to do it today, on how this can actually help you as a practice owner and your team overall and your patients overall, obviously, because they're the most important people of all.